So when you look at these long-term studies of active surveillance, likelihood of staying on surveillance as late as 10 to 15 years is around 50%, depending on which cohort you look at and how long of a follow-up period we're looking at. And of the remainder, these are men that started off on active surveillance, stayed on for 6 months, a year, 5 years, whatever the time may be, and then when we saw sign of progression, they went on to surgery or radiation or other treatments. Or in some cases, they just got anxious and opted for treatment, even though it looked like everything was fine. Now, I think that latter category is getting to be less common as time goes on, and the whole community is more comfortable with the concept of active surveillance. We used to see that about a third of the men that went on to treatment after starting surveillance did so in the absence of any objective sign of progression. So the Gleason was still low, the PSA hadn't risen very much, everything seemed fine, but the guy just said, I'm up in a cold sweat every night, thinking about the cancer. And in my mind, that's very often a failure of counseling. There are some men who are just extremely anxious, but there's a lot more men that could be, safely pulled back from that cliff of despair with better counseling.